Hi everyone, my topic is how muscles age and how exercise can slow it. Bad news, if you are over 30 years old, you have already begun losing muscle. Up to a quarter of adults over 60-year-old and half of those over 80 years old have thinner legs and arms than they did in their youth. What are the symptoms? Hard to climb stairs or even get up from chairs. This may make it difficult for many elderly people to carry out daily activities. Older people can enter a vicious cycle that will eventually lead to an increased risk of falls, may lose independence, even premature deaths. How muscle age? There are some factors that would lead to the muscle aging. Decreased numbers of muscle stem cells, mitochondrial dysfunction, a decline in protein quality and turnover, hormonal deregulation. Skeletal muscle consists of multinucleated fibers formed by the fusion of muscle precursor cells, or myoblasts, during embryonic and fetal development and postnatally until the tissue reaches its adult size. Mature fibers are post-mitotic, meaning they do not divide anymore. As a result, in adulthood, both muscle growth and repair are made possible only by the presence of muscle stem cells. Researchers have demonstrated that muscle stem cells are the only cells able to repair muscle, which explains why recovery from muscle injuries among the elderly is slow and often incomplete. The number of muscle stem cells falls from 8% of total muscle nuclei in young adults to just 0.8% after about 70 to 75 years of age. Strong evidence show that mitochondrial dysfunction may be driving sarcopenia, the expression of genes and production of proteins that regulate mitochondrial fission and fusion, processes that maintain mitochondrial volume and function. Also dropped, suggesting that mitochondrial dynamics are also perturbed during muscle aging. What good news! Exercise can stave off and even reverse muscle loss and weakness. Physical activity can restore levels of signaling molecules involved in muscle function. How exercise to combat muscle aging? Although the causes of muscle loss are numerous and complex, there is now copious evidence to suggest that exercise may prevent to reverse many of these age-related changes, whereas inactivity will accelerate muscle aging. A research from last year showed that a lifetime of regular exercise can slow down muscle aging. There were no losses in muscle mass or muscle strength among those who were older and exercised regularly. More surprisingly, the immune system had not aged much either. Exercise's influence on muscle health likely acts through as many mechanisms as those underlying age-related muscle loss and weakness. For example, the number of stellate cells can be increased by exercise, and active elderly people have more of those cells than more sedentary individuals do. This is the reason why exercise prior to hip and knee surgery can speed up recovery in the elderly. Physical activity also affects the muscle's mitochondria. A lack of exercise decreases the efficiency and number of mitochondria in skeletal muscle, while exercise promotes mitochondrial health. Exercise can even spur muscle cells to maintain more useful levels of gene transcripts and proteins. Additionally, exercise improved muscle function. the older adults were 59% weaker than the younger adults before training, and only 38% weaker afterwards. Thank you.